So is the concept of you here again to benefit from the tips we have to offer. And if you ever want more information, as usual, you know where to go. That will be on Mana Handy Tips on Facebook. So it's really nice to have all of you here. So why don't we get started? Wait, not quite yet. As you know, we always want to allow one, two viewers to get ready, especially when we know that we're dealing and helping our not only elderly ones but ourselves as we getting in the process of aging. Yes, it's unavoidable and you can escape it, but yes, you can deal with it a better way and naturally. And that's the reason for us being here together to exchange tips. That's why our name is Mana Handy Tips. So, welcome here on the platform. So, why are we here? What are we going to talk about? As you can see, here we about to talk about more of the problems we have in the joints. And the name of the culprit we about to talk today is osteoarthritis. So, as each and everyone know, the studies and experience in life have shown that osteoarthritis, diabetes that we just talked about recently, and other related mobility disability become frequent as the population ages and become more overweight. This is a fact. Okay. And when we think in fact, that means this is something we can't really dispute. Right. But when we know we have ways to work with it, that's what we're looking for. That's what the tips are for. So here we are. Why don't we define some words? As you can hear is osteoarthritis. There is a word we hear often in there, which is arthritis. So, what is arthritis? Well, we can say simply, shortly, that is a swelling and tenderness of one or more of your joint or my joint, because we all going through this same process of aging that we don't like, but that we can't avoid, right? So, as we hear, let's talk more about this very thing. How many forms of arthritis are there? We have at least three, osteo being one of them. So let's define the two others first. Let's mention them. We have rheumatoid arthritis, which is an autoimmune disease, which means that the immune system attacks part of your body, especially the joints, and that is the rheumatoid arthritis. What's the number two? Part number two form of arthritis, that the psoriatic arthritis, and that affects the skin and joints. Now, let's come to our culprit that we're talking about today. This one is the osteoarthritis. So, when we think osteoarthritis, we usually have two words in there, don't we? And what are these words? Well, we have osteo, then arthritis. Arthritis, we already defined it and talk about it. It is the tenderness, it is the swelling and therefore painful of the joint. Then the osteo has to do with bone. So osteoarthritis being the most common form of it, and we're gonna talk a little bit more about it. This is the one that frequently develop with age, and this is a chronic condition and that affect millions of people worldwide. Remember, while introducing the title of our discussion today, we were saying, why do we need to know? About one of the reasons will be that it affects millions of people worldwide. That means we got to be concerned with this. We need to discuss more about it. We need to be informed more about this and know what we can do. Although we don't have the ability to eliminate diseases or all these things or conditions that come with aging. We can learn natural ways to deal with it. And no one says no to less pain, right? If you can get your pain down, you want to know how you can do that. And that's why we're here. That's the way to be of the tips we're talking about. So, what actually happens during osteoarthritis? Well, the protective cartilage, the cushion that is at the ends of the bone or the joint, wear down over time. And as it does, the bones rub against each other. And they're not meant to rub against each other. So that means discomfort, pain. Okay. And that can be intense pain. So, although osteoarthritis can damage any joint, this disorder most commonly affect joints in your hands, okay, and then knees, hips, feet, and spine. And when you hear spine or any kind of joint, because we need to move around, and the pain in those areas can be really painful. Now, we've known that there are different stages of osteoarthritis, and we're going to talk about the symptoms and then we'll mention the stages as well. What are the symptoms? You understand why we're proceeding that way. Let's talk about um, something that you feel and you know it might be something. Symptoms of osteoarthritis usually begins after age 40. So here we're narrowing down who we're talking to today. This doesn't mean that if you're not 40 yet, you shouldn't be informed. You shouldn't want to know. Okay? Because even if you're not there, you can get there very soon. And I wish you so. And you might have people in your family, in your friends that are already there. That's why you and I should be concerned. So, but we see the population that we're talking about here. So, when you reach or after age 40, and that can vary a lot, these symptoms become frequent. Okay. And more often, it's going to be the area we mentioned, like hands, which means fingers, feet, knees, hips, and spine. And less commonly, the elbows, the wrists, shoulders, or ankles. Around that age, that's what we get. And these symptoms include what? Joint pain. Joint pain worsens with activity and is relieved with rest. That's something you know. Oh, this is what's going on. And in severe cases, joint pain occurs even when you're resting at night. I know a very friend of mine who would tell me, Mana, I go in bed with pain, and in the morning, I can barely move. And I'm stiff and I'm in pain. That's why we're talking about this. Because I know it's not my friend only that is going through this. That's why we need to talk about it here, and so we can let everyone know. So it's awesome to see that many are here to benefit from this. So it is interesting to know that Debbie R is here. Hi, Debbie. It's always nice to have you. So let's keep going. It is important to get this info, even though we personally might not be the one needing it or suffering from it. Okay, so we're talking about the symptoms and we mentioned joint pain and we say when it can be worse. And this pain is felt over or near the affected joint, but it may also be felt in other areas. Number two, what do we have? Joint stiffness. Note here, joint pain can be there without the stiffness. So this is something else. And it happens often in the morning. Like the friend I was just talking about, you wake up, you're trying to get out of bed, you just can't because you're stiff. Okay. And it usually goes away within 30 minutes of rising, but it may come back throughout the day. if someone is not active enough. So see here. So stiffness may also occur when it is cold. And some people may tell you that they feel the cold coming. They can tell you about the weather just because of how they feel the joint is feeling. That's how they can tell you whether there is low pressure weather. They know, they feel when it's coming. So joint stiffness definitely is different from joint pain. It's two different things. So let's welcome more here in our platform. We see a very friend of mine, and that will be Ajo Amuzu. Some will say Adezo. Welcome, Sylvia. It's a pleasure having you here. So let's talk more about the symptoms. We've mentioned joint pain, joint stiffness, and number three is joint swelling. Again, you can be stiff without the swelling part, although all three come in common, the companions when it comes to arthritis or any forms of it, especially the one that has to deal with bone, which is the osteoarthritis. So now that we've talked about joint swelling, how does it come? It can be a grazing or hissing sensation that you have. You can see physical changes in the joint shape, and you know this is swollen. You can see bone spurs. It could be smooth or it can be hard bumps, or you can even see extra bones that form on the end of your bones. Okay, and that means they're popping up in the joints. And something that is popping up where it shouldn't be, you understand this is something that really definitely it hurts. And if you enjoying this presentation, keep it coming. Show you like and show you love it and go share with who needs it. Okay. Now let's talk about the stages. What are those stages? We have stage one, which is minor. So you just feel like little or no pain in the affected area at that point. Then, of course, it's going, if it's not taken care of, it becomes mild. Mild is more noticeable, okay, and you feel stiff in periods. Now, on not throughout the day, I would say, but on and off. Okay, and at that time you may need a brace. Some may need a brace, and we also have stage number three. So, what is stage number three? There, we notice a cartilage in the affected area, and that we notice that it begins to erode. So, the joint becomes inflamed and causes discomfort during normal activities, things that you do normally. You feel pain while doing it now, because it is inflamed. And then, last stage, that's the worst, stage number four. So what happens there? You are in a lot of pain. I don't wish you to be in a lot of pain, but I'm just describing so you know when you have these symptoms, this might be my joint acting up, this might be arthritis, and it might be this type that we're speaking about today. So there it is severe. This means that the cartilage is almost gone. Simply put, what is the cushion that's supposed to protect your bones, the ends of your bones is no longer there. So they're gonna rub more against each other and you're gonna hurt more. And that's what happens. So we have overgrowth of bony spurs, and that means severe pain that is going on. Now we explain what it is. We've talked about the symptoms, but what really matters is that we know where it's coming from, as usual, right? And if we can prevent it, do something about it the natural way. So, what are the causes? Primarily, osteoarthritis is the breakdown of cartilage over time, like we said. And the risk factors, number one is advancing age. And we all know we were born babies, but today we're not babies anymore. So the growing process is going, and then the aging process is gonna kick in. These things have consequences. So it's really rare under people age 40. It can happen, but oftentimes it's when you hit that 40 going that you're going to feel this. And we know that at least 80% of people over the age of 55 have some x-ray evidence of osteoarthritis, even if they're not feeling the pain yet. So we don't want to wait to feel the pain to take action that we're going to talk about later. Gender, it affects more women 2 times or 3 times more than men. How fair is that? Well, that's the fact. Anyway, that's how it happens. So we ladies are more likely to develop osteoarthritis. And also another risk factor is obesity. It could be the occupation, the kind of job we do. You know, if we walking several miles each day, standing a long time, we've had joint injury. Sport, sport is enjoyable. Reasonable degree is enjoyable, but it can be things like wrestling, boxing, cycling. I love my bicycle, but even cycling, especially when you do it as a professional, it could lead to this, unfortunately, and even soccer and many other things of this kind. Now we know where it could come from. We want to say this as a caution, okay? Non competitive running does not seem to increase the risk of developing osteoarthritis. It's just the contrary, exercising healthy way that helps our body rather than tearing it down. So we want to find the balance while talking about sport that could cause osteoarthritis. Okay, we're just talking about the competitive versus the normal way of getting in shape. So, what else can we say about it? It feels good so much, Sylvia, to know this is benefiting you and your family. Thank you so much. I'll take the compliment. Now, let's get back to the tips, right? That's what we hear. Now, let's talk about other causes. Some type of things we put in our body, some foods we eat, you know, can be the trouble when it comes to osteoarthritis. Someone said we are what we eat. So some ingredient like sugar, yes, that sugar can be trouble, as we know. We've heard about that while talking about diabetes. Okay, we're talking about it here again when it comes to osteoarthritis as well. And fat, that's another culprit. Junk food. I don't think anyone like those words. But sometimes we understand we're in a hurry and we go with fast food. But when we make it a habit, you need to know this can hurt our body and can lead to that. So we want to be careful. We want to choose wisely. Refined carbohydrate, you know, tortillas, biscuit, white rice, and we want to know if we need to blend it with a lot of veggies, we're gonna have to do that. But these things we need to be careful as what it can do to us. So what about fried food? You guess it. Fried food also, too much of anything bad is not good. Okay, and they say sometimes too much of good might not be good neither, but especially so when we're talking about these things. So we might be indulging in some of these things when we were pretty young. As we getting in age, we want to be careful. We want to really take time and be careful, know what we put in our body. Why? Because things are happening and have consequences. Processed food, and other things. So partially hydrogenated, for example, and the list goes on. But at least we've got a few information here. I know my kids, they're really young, and sometimes they'll go, Mommy, beef jerky, beef this, beef salami, all that. Yeah, smoked meat. It tastes sweet, but they'll have to know, just like I've learned, that when the aging process kicks in, you're going to have to slow down into eating these things to have a better health. And that's what we're talking about here. And not to put the stadium for things like osteoarthritis to be there. Let's talk now about consequences. And we want to focus on the long-term effect, don't we? Well, you guess it. This is actually a degenerative disease that worsens over time. And even if you don't get diagnosed with it, when you feel all these symptoms we're talking about working in harmony, being together, you want to stop and slow down on the bad things we just talked about, or things that can be as genuine, as innocent, or as enjoying some food. But even if you don't get diagnosed, you'll do well to slow down on how much you're getting of those inside your body that is aging and is not able to process some things as it used to. So, osteoarthritis often result in chronic pain, joint pain, stiffness, can become severe enough to make even simple daily tasks difficult. Okay, that's a serious consequence in itself. If you can shower yourself, you can make yourself a nice meal, you can do the things you use, you can just get out of the bed. Something simple as that can become, if you can't get out of your bed, what are you going to be able to do? See? So daily tasks become difficult, and without treatment, this chronic pain can lead up to complications that can significantly affect your quality of life. I'm going to repeat that. If left untreated, it can go to a point where the quality of life that you have is affected. Things can be the same. And when it affects you, it affects family, it affects friends, it affects everybody. Okay, I know when I was sick and my kids will have to visit me in the hospital, the little one, he'll tell me often, Mommy, I miss doing this with you. Mommy, I miss doing this with you. So when we impaired, people around us are too, our loved ones. So we want to pay attention to these tips, this information, understand, and then take the steps that will alleviate things. So it can be so exhausting and unbearable, and this in turn can lead to sleep disruption, reduced productivity, weight gain, and ultimately anxiety, depression. I don't think any of us like those words that I'm saying, because they're not nice to our body, and our life is turned around the wrong way when we experience those things. So now, extra weight may exacerbate, may increase, may get it worse osteoarthritis symptoms, and as well as lead to an increased risk of other complications, including that diabetes we talk about, hypertension we talk about, heart disease. This simple becomes a vicious cycle, okay? And vicious circle and cycle. And one lead to the other, which lead to the third, which come back to the fourth, and back we at the beginning with the first one that started it all. So it all go together. So we do well to pay attention. Why? Because we don't control aging, and then the consequences that come with it, we're just gonna have to learn to deal with it a nice way as possible. Now, as we always do, these all sound like, okay, boom, 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 negative things, causes, consequences, and all that. What I can't eat anymore, what I can't do anymore. But how and what can we deal with this osteoarthritis we're talking about today? Well, what is the treatment for it? That include lifestyle modifications, medication, and or surgery. And you know what? Surgery is usually the last resort used to treat severe osteoarthritis that seriously limit a person's activity and does not respond to other treatment. So why will we get to surgery? Why will we get to medication that will have side effects if we can do other things now to lessen the issue? Lifestyle changes, what can we do? Those like me who will love cycling, even stationary bike, you can do so. But if your circumstances don't allow, don't dare. Now, you can strike a pause. What does that mean? I love dancing personally. Okay, so dancing mildly, even if we 50, 60, 70, we can still swing around, and that can help also. We're moving and we're moving the joints, and that's helpful to our body, even to our painful joints. We can make a splash swimming, we can set a goal. Some people love many other things, vacuuming, gardening, and all that, and all that. And you know what? Oh, thanks so much. Sylvia, very much appreciated. Your job is to take this info and make it available to as many as possible. So, we're talking about bursts of activity, vacuuming, gardening, standing straight. Yes, just take a time for 2, 5, 10 minutes. You're standing straight, trying to straighten your legs, your joints, your whole body. That can help too. You know, that can help absolutely. That can help. So just standing straight. And I remember I often tell my kids when they're in school, sitting, they'll be like this, or some postures that are not so right. Standing straight can help. We can start as little as that. So we have a full array of things that can be really helpful to us. So now it comes to natural, natural, natural. You know, today we all know and agree that our grandparents used to eat more healthy than we do today. So there are supplements and other natural resources out there that we can use. And if you wish to know more about those, you know what to do. Join us, Mana Handy Tips on Facebook. WhatsApp me, do what it takes, and I'll be happy to provide that information as well. You know, so food to eat. Remember, we talk about food you can't eat, but you gotta eat something, can't you? So, food to eat that will help with this joint problem, with this culprit called osteoarthritis that we're discussing. Berries. Berries, meaning strawberries, blueberries, raspberries, blackberries, and the list goes on. There are so many different kinds of berries, cranberries. There are so many other berries out there that I don't know yet that you may know of, but berries, that family, very, very good for our joints, for our bones. And you remember we talk about fat. We said some type of fat not good and can worsen this. But fatty fish, okay, will have. What are those? Salmon, sardines, and mackerel, anchovies, and many more. And other foods such as broccolis, avocados, green tea. And there is a tea that I take every night. Is really helpful. It's made out of some really, really basic items. Cinnamon is one of them. So you want the full list, please WhatsApp and you get it, or inbox and you get it. So what else? Dark chocolate. Don't leave any dark chocolate near Mana. She'll finish it. Don't indulge too much in it neither. It's just to tell you there are things, and even cherries. There are things, some food that we can increase and that will help us. Okay. So what have we talked about today? We've explained what osteoarthritis is. Think about two words: osteo, bone; arthritis, that we know has to do with pain, swelling, and tenderness in the joints. And that's really painful. And we mentioned 4 stages. And it start very where it's not even noticeable, and then it turns to mild until we get to severe. We talk about things we should be careful not to eat as much once we hit 40 and going up. And we mentioned some habit that could help us, where we choose nature that is so well for us at our disposition from our creator For those who believe in the Creator, we have it all out there that we can use, avail ourselves. And we've also mentioned natural things you can eat, you can do that can help deal a better way with osteoarthritis. So I hope y'all enjoyed this time with us today. We provided some tips, we provided information. If we choose not to do anything with this information, guess what? Well, nothing will get done. That will not help anyone. But if we choose to take this info and help ourselves and someone with it, well, you'll feel and others around you will feel some relief from it. It's true, you or I might not have the power to eradicate aging process. We don't have the power, the means to just make it disappear. It's coming soon though. You want more info on that too? Please WhatsApp me. But what I can say is the natural stuff we have out there do help. I'm a recipient myself, and many in my family, in my circle of people, and even strangers that reach out to me and others avail themselves of that. So it's your turn. You choose to have it, it's all yours. Please join us as Mana Handy Tips on Facebook, inbox, WhatsApp for more info. But by all means, use this info to benefit yourself or to benefit someone. So it was nice having you all tuned in today. Our times is up, so don't want to hold you, but I will tell you next Saturday we will have this that will be rebroadcasted. So if you miss any part, come back Saturday, you have it again. Otherwise, see you soon. Enjoy the rest of your time with family, any plans you have, and we'll see you next time. Mana Handy Tips is the key, and we remain open to your tips as well. So we thank you so much for today's time. Bye bye.